this morning. So thank you so much for coming along. My name's Julie Graham and I'm quite new into the user involvement team. I think most of you on the call will have come across me at some point in the corridor, so still quite new. So I'm not really going to take the lead on too much this morning. I'm going to pass over to the lovely Patricia, who I suppose has talked the talk and walked the walk really whenever it comes to user involvement. So we're really going to hear about how that has been incorporated and how Patricia then has been able to make really positive service improvements to the service that she delivers and the service that she's part of. So Patricia, I'll share these slides here for you, and then really I suppose it's over to you.
Right, thank you so much. Thank you. I just, when Julie's sorting that, I am by no means any kind of expert. I'm just fumbling in the dark, trying to do my best, I reckon, as most of us do. But I had a really positive experience of service user involvement in the last service that I worked in pain management, and I wanted to bring that forward to my new service. So that's what this talk is about today. So thank you, Julie. I can now see my slides. So do you move these on for me then? Is that okay? Yeah.
Yeah, no worries. Yeah.
Thanks. Thanks. I'm just back from annual leave today after 2 weeks off, so my brain is somewhere else. I think it wants to be somewhere else rather than here today. But anyway, we give this a go. Yes. So I had worked before with service user involvement, and I had recently got a new job, and my new job is literally setting up an entirely new service for adults with diabetes. So I literally was starting from scratch. There is just me and a very limited resource therefore. So I wanted to use service users from the outset to make sure that my service was as targeted as possible to what the need really was. So I guess was looking at a whole load of things here, but one of the biggest things to start with was the barriers, because I work 3 days a week. There is only me, and I guess it's hard to know what to do. I think at the start I was really quite overwhelmed by it all, but just had to take it bit by bit. So this PowerPoint today is very much broken down into all the steps that my brain went through as I progressed in establishing the service. So the very first thing I had to try to do was picture what on earth the service was going to look like in terms of governance, in terms of what service users needed, what they wanted, how I could offer that with my limited resources. I was so aware this is a very, very complex long-term medical condition, and having worked in the pain service and also in the fertility service, I really was very aware of having to make this very biopsychosocial and look at the total person and not just their diabetes. So using service user involvement was really a huge part of this, trying to make it as targeted as possible. And for my own emotional well-being in this crazy journey that I'm on, I really wanted to use other people's experiences and expertise as well to help me. So that's a wee bit of the background of it all. And so moving on then, Julie, thank you. My first port of call was really to understand what the needs were. So going into any project, like if you're organizing a party, you want to understand what everybody needs. I was looking at this the same kind of way. So I thought about, well, who on earth is going to be involved in all of this? So my first port of call is always going to be the people with diabetes themselves. And then I looked at families and carers and supporters and what was available already in my own workplace. I also identified the multidisciplinary professionals, and the diabetes service in the Southern Trust is actually set up incredibly differently from other services that I've been involved in before. So I had to navigate my way around that. And Diabetes UK have been fabulous, absolutely fabulous. I couldn't sing Susie Hall and her team's praises enough in all of this. Something else that was really important was to benchmark other diabetes services throughout the region that we operate in. And I was able to do that quickly enough. And so I moved on to other psychology services outside our region, because they tend to be so much more developed than what we have here. And I thought I could learn a lot more from them as well. And also thinking about my own management team and what I needed from them and trying to understand what they needed from me as well. So there's a lot of thinking and identifying all of these people. And then, of course, the next step that I wanted to move on to was how could I learn from all of these people? So for me, this was indirect service user focus. So if we move on to the next PowerPoint, Julie, please. Thank you. So this was how I was involved at the outset, indirectly with service users and with all the different stakeholders. So it was a fast learning curve for me in terms of diabetes, and I do have friends and colleagues with diabetes, but I can honestly say I did not know the full extent of what people endure on a daily basis. I did a biomedical course and I learned so much technically and clinically about diabetes. I also did a diabetes leadership course through Diabetes UK, and on that I was blessed in meeting people who worked in various diabetes services, and also I was blessed in sitting in on service user groups, both here in Northern Ireland and across the water. So that in itself was amazing as well. So, but I was doing that as part of my course, and that's why I have it in under indirect there. I also then went to podcasts, became my thing during COVID. So I've continued that on, and I listen to lots of podcasts now, diabetes related. So one in particular that I find phenomenal was a whole set by Jen Greaves. And I now use this lady as an onward referral source or self-management source for my clinical work. So again, all about learning, all about how people with diabetes live and thrive rather than just survive. I upgraded my motivational interviewing skills because, again, this is very evidence-based in terms of having chronic health conditions. And I went to our own diabetes team, our multidisciplinary professionals, to meet them and to see, well, what are the common presentations in diabetes and how might I, as a psychologist, be able to help with some of those, bearing in mind my resources. So then I learned a lot. Yes, thank you, Julie. And I decided then it was time really to talk to the real honest to goodness people on the ground here who live with this condition. And so I have set up a number of PPI consultations, and my whole aim the whole way throughout is to include as many people as possible, to collaborate as much as possible, to demonstrate partnership as much as possible, and literally to chat. That's so much of it comes down to, chatting and building relationships with everybody possible. So I was always trying to find out, what do people need and what can I offer? So this, I have to say, I started doing all of these before I started seeing people in clinics. But I'm also doing all of these now that I am seeing people in clinics. And somehow it almost even makes more sense now that I'm actually offering clinics and seeing real honest to goodness people in that clinical setting. So I organise some diabetes focus groups. We have another really big one due to be launched in June, which I'm so excited about, and it's current patients that attend our clinic, as well as other people from the PPI register who have diabetes, and also other people from outside who have never attended the service but live in the trust area. And we also have the mental health forum involved. in that as well. So we have lots going on, and these are people with type 1, type 2, and gestational. So there's a lot going on, and a quite direct focus now on service user involvement. And I suppose I'm trying to cut a long story short here. What are the outcomes and the benefits? And I'm thinking about this in terms of, first of all, the service user. So I guess my mission from the outset was to make this a really dedicated specialist psychology service for people that really understood, I guess, the complications of living with a long-term chronic health condition as complex as diabetes. These people are literally living in a world where their pancreas is not working. And whenever we don't have one of our organs working, it creates havoc in our world. And because this is such a hormonal condition as well, our endocrine system is impacted. So there was lots to learn and lots to incorporate into my clinical practice. And I really think that knowing that helped me deliver on this very specialist service. So not only is it generically specialist, it's also specialist to each individual person that comes here. So we really try to meet the person at where they are at in their diabetes journey. And that is a very privileged position for me to be in. We wanted to work with people who were ready to change, because we can have a condition and not be ready to change and improve our quality of life. We know, for instance, that we're supposed to eat 5 to 8 fresh fruit and vegetables a day. We know that, we know what we should be doing, but sometimes we're not ready to make that change. So it's really important with such a limited, small service that my time is used efficiently. So I needed to start working with people who were ready to start making change. And I also then I have been making it really clear from the outset that I want people's input. I want people's feedback. So everybody completing in our service gets a service user feedback form to complete and is willing to join a register. Then we will take their name as well, so they can help us out at a later point in time if they wish. And I really hope that people are experiencing this very safe journey from triage right through to discharge. And I personally as well, I'm so mindful of this is me. And when I hopefully won't take sick, but if I do, and I care for my elderly parents, if they're no longer around, I will need time. How am I going to future-proof my service for service users? Because they're the bottom line in all of this. So I've been thinking around all of that in terms of outcomes and benefits for the service user. In terms of outcomes and benefits for the Southern Trust, equally important that what I'm offering for me is co-produced, and this next pilot that we're going to be delivering is going to be so co-produced. I just have great hope for it, but we've tried to co-produce what we've delivered to date. And we're constantly evaluating and changing and evaluating and changing according to feedback. For me as well as a clinician, I am all about governance, good governance. So I am happy to say that I would be happy to be audited in my service at any point in time, because I've set it up from scratch and it's very new. We went live in November, so everything at this point is very good, in very good condition, despite the pressures we're under. I also wanted to continue networking with all stakeholders to continue with service development. And all of this has been done, I have to say, set within the context of the strategic framework for diabetes that was established way back in 2016. So I'm trying to incorporate that in as well. So I have some networking events in relation to that to attend in the future. It's only getting back off the ground again post-COVID. So I have a shared drive for all clinicians. So this is a multidisciplinary team working in diabetes that I can share everything to do with psychology that I think might help for them when they are with their service users as well, because I want to encourage them to engage in service user forums as well. So I haven't got there yet, but that's my hope and my dream. And of course, I have all the SOPs developed and all the necessary documentation. So in terms of the Southern Trust, it's a fully it's established, it's developing, and it's set up with good governance. And I'm happy to say, yes, that this is where we are now. So lessons learned. The hugest thing for me is that there is so much potential for service user involvement. It is a phenomenal tool that we have, phenomenal resource, and it can be accessed in so many ways and used in so many ways. I tend to get very excited about things, very passionate about things. And one of the things I also had to learn was here, hold on, Patricia, one step at a time, keep it moving and keep juggling all the balls, but keep it one step at a time as well. And it's incredibly important. As a psychologist, I'm a very reflective person. My husband always accuses me of thinking too much. That's me. But that's a good skill in this role as well. To be overseeing the development of this new service and to make sure that I am learning from all that happens in this journey, and can make positive changes. I am learning to be prepared and to be proactive, and to, well, I guess I always was those things, but it is so critical in all of this, and I have to be open to learning very much around diabetes and the implications of this on real people's lives. And I learn something new every day about that. So I'm also building a list of networking contacts, which is great and growing phenomenally, I'm happy to say. I want to hear and value and respect differences, because there are a lot of differences in how, like, I have a trainee at the moment and he's a real blessing and helping me out with some PPI. He is studying at Queen's, and Queen's have a very different way of working from the trust. And the trust and Queen's have a very different way of working from the mental health forum. So we have to try to listen to everybody and respect all the differences and pull it all together in a way that is meaningful for the real people who are participating in our service user forums. And I want to be able to take responsibility for the decisions I make to move our service forward, and have a very sound rationale. And that comes from listening to service users and closing all of the feedback loops. So all the conversations we have, it's really important to keep remembering to feed back and to reply to their messages, their emails, and keep them in the loop and thank them. That too is imperative. So I guess that's a very quick fly through of what I've done. I'm very happy to have any questions, fire anything at me. Mind you, my brain still is a bit fuzzy from annually, but I will do my best to
Well,
answer any questions.
Patricia, thank you so much from us. I suppose before we kind of open the floor to questions, I was just going to kind of throw in my tuppence worth from your wee one-stop shop there of everything you've done. I suppose for me, what stands out is really that user involvement is part of your practice. You know, from the very start, you said something there about what was it, from triage
Yeah.
to discharge. So really, that whole pathway, you have really kind of thought about that at every level. And you had said as well there, it's constant evaluation and it's constant change. And my PPI colleagues on the call here will know that is it exactly. You know, sometimes you can start off with the best will in the world. You know, I'm going to have people involved at every stage. But another thing you said there, Patricia, sometimes it's about getting those right people, and sometimes that can be really quite difficult. So even though we kind of have the best intentions of the world, as I say, it doesn't always work out like that, and that's okay too. You kind of take what you can get in terms of, somebody could help me with a leaflet, happy days, that's okay. Somebody could help me, in another area. It doesn't necessarily have to be those same people throughout. So I thought that was really, really important. And, for me as well, just kind of listening and kind of hearing the work on the ground, I think that's a really good way for us all to learn. And I suppose a wee plug from the PPI team as well, and Jared, this is your baby, our community of involvement. That's what it's all about, learning from one another, us as a team being able to direct other colleagues, to somebody who has a wee bit of experience in maybe a similar project that they're doing. Even within the promoting wellbeing division, there's so much skill and so much expertise there. So, for example, if you don't know how to facilitate a group or bring people together to, attend a focus group, don't be afraid to reach out and ask, because I suppose that's what we're all there for. So, thank you so much, Patricia. Does anybody have any questions for Patricia before we let her head on?
If I could just, sorry, Julie, really just following on from what Julie was saying, Patricia, thank you so much for the press. I mean, you're an absolutely fantastic example of someone, who's really engaged with their service users, and the benefits of that have clearly paid off. I'd say we might be calling upon you to share your story with other colleagues, because I think we're very mindful, user involvement's our bread and butter, and we're constantly trying to promote it. But it's really great to hear from practitioners what it means to involve service users in practice, and you've identified all the positives and some of the challenges as well, which is what we're very mindful of too. But it's and that it's a journey, and so I just really appreciate you taking the time to talk to the division about it. And it just sounds like it's been such a great service, and as you say, it's constantly evolving, and that user involvement's just sounds like it's just been so crucial to that, and there's been so much learning. So it's been absolutely brilliant. I'd say we'll be calling upon you again, Patricia. You'll be blocking our number.
No, I'm very happy to be called upon again, but I guess as regards change, I like change. I'm one of these people that likes change, but I would say it has actually been beneficial in some bizarre way, control freaky way, maybe, that there has only been me to set the service up, because I've changed things so much through talking to people and evaluating, that if anybody else was involved, they'd be saying, there she goes again, what is she at this time, So I'm glad in that sense, because I know you can get so much information from people, as you say, from so many sources, but ultimately you have to develop the rationale and make the decision as to why you're doing it this way. And I think you have to be very solid and very confident in that, but very respectful as well. And it's just getting the right tone sometimes. But yeah, learning who's out there is just amazing. I mean, I don't know all the people out there, and if anybody knows anything about diabetes, or if you're thinking, oh, I could help her with that, please come to me, because I welcome you with open arms, and yeah, ready and willing.
Jared, do you want to come in there?
Yeah, thanks, Julie, and thanks very much, Patricia. Just on that last point, to see that Catherine has put a comment into the chat there regarding, so one of the services that we provide in the Promoting Wellbeing Division is diabetes prevention program. So I think Catherine might be keen to link up with you there, Patricia. No, I just wanted to echo, I'm Jared Rocks, by the way, Patricia. I'm Assistant Director for Promoting Wellbeing. So I just wanted to echo what's already been said by both Julie and Miriam. You really are an advocate for involvement, and it's very gratifying for me to kind of feel the enthusiasm that you're expressing here. And we know that involvement is hugely rewarding, never mind the fact that it's a statutory responsibility for health and social care, but it is hugely rewarding when it goes well, and that's not to say it's not without its challenges. So everything you've been saying here this morning, I think has been hugely insightful in terms of, you know, what involvement means at a service level, but also what the benefits of it are. So you really are a terrific advocate, and Miriam has already said, you know, we could be hauling you into all sorts of talks and opportunities for people to learn, because I think there's so much from what it is you've shared with us today that we would want to ensure that others are kind of you know hearing about. I did have a number of questions for you, but to be fair, throughout the course of your presentation, you've already answered them. You know, and I think that last slide in particular about your own lessons learned would be hugely beneficial for others who are maybe not sure about what involvement means and how they do it. And I know that, you know, Miriam and Julie and the rest of the team there are always on hand to provide that support. But genuinely, you know, hearing the experience of people like yourself at a service level can say so much more about the importance, the mechanics, and the value of involvement. You know, for others who are maybe just not sure about that across the organization. So I just wanted to add my thanks to what others have said, Julie or Patricia. Appreciate the time you've put into it, and also, you know, your sharing here today. So thank you very much.
No, you're very welcome, and I firmly believe that we're all here on this earth to help others. So if I can help in any way, I'm happy to help as we move forward, as we all move forward. But I suppose I just want to reassure people that, you know, you mentioned challenges there, Jared, and there are challenges. And one of my major challenge really was that I didn't know enough about PPI. I actually thought I knew a fair bit because I had been involved in it in the pain team and in fertility, but that was only small parts of it that I realized, you know, whereas whenever you're setting up a service, there's so many other parts that you have to learn about. Well, I felt I wanted to learn about rather than having to. So I think it's fair enough that even if you're starting out in a PPI journey, to know that there's no way you're going to know it all. I mean, I keep learning in this process as to who and what and where and why I'm doing things, you know, but that's okay. That's part of the fun of it. But just be reassured that whatever you do, however you reach out to people with a good heart, wanting to know and to learn from their very precious, valuable experience, that will really inform your practice and your service, and that can only be good. So don't feel the pressure of having to know everything about PPI. I think I felt pressure about everything when I started this job. So I'm just trying to eliminate some pressures.
That's great, Patricia. Thank you so much. Does anybody have any final questions or parting thoughts for Patricia? Everybody okay?
Sinead here. Just wanted to echo really what people are saying, and I didn't know what to expect from this Link and Learn this morning, and this has absolutely been fantastic and opening our eyes and making us think too as how we as a division can better support you, Patricia, in a new service, and indeed any others who are going to be setting up a new service or working within an existing service. I think maybe, I'm not sure if you have links even with our inclusion worker. I'm thinking of the culture and language barriers, particularly, you know, the increased rate of diabetes within the Irish traveller community. So that would be a good link, and we'll share that information with you. But I really enjoyed that presentation, and thank you so much for your time and the effort you put into it. It was fantastic. Thank you.
Thank you, everyone. And Catherine, I see your message there in the chat. Please, please, please reach out. Email me. Please do.
Yeah,
and anybody
definitely.
Else? Anybody
I will.
Else? Thank
Sorry,
you.
my
Thank you,
camera's
Sinead. Yeah.
acting up, Patricia, but I'll definitely reach out and make contact, because there was a few things you were saying there. I was thinking, oh yeah, that'd be great. You know, even the motivated to change and stuff, because we'd have a lot of participants coming through, and it's trying to get them motivated to change, and you usually know the ones who are motivated and not. So don't worry, I'll definitely touch base.
Fantastic. Brilliant. Really appreciate that. Thank you.
That's great. Thank you so much, everybody. So we'll make those links, Patricia and Catherine and Sinead and Robbie and everybody else who we think could add kind of benefit to that and support you as well, Patricia. So yes, thank you so much for coming along, everyone. And I suppose any questions or any kind of things that come up and you think, God, I wish I'd asked that or whatever, come and give us a shout or call into the office or whatever. You know, there's always somebody about down here. So yeah, thank you so much. Take care.
Thank you, folks. Thanks so much.
Thank you,
Thanks.
everybody.
Bye.
Thanks,
Bye.
everybody.
Bye.
Cheers.
Bye.
Bye. Bye.